1. What is the nurse's priority action before administering digoxin to a pediatric patient? A. Assess blood pressure. B. Check apical pulse for 1 minute. C. Monitor oxygen saturation. D. Evaluate bowel sounds. Answer. B. Check apical pulse for 1 minute. Rationale. Digoxin can cause bradycardia. Always assess apical pulse for a full minute. If below the safe range, hold the dose. Blood pressure and oxygen are important, but not the first priority here. 2. Which lab value should the nurse monitor in a patient taking warfarin? A. APTT. B. INR. C. BUN. D. Platelet count. Answer. B. INR. Rationale. Warfarin affects the INR. Therapeutic INR is typically 2 to 3. APTT is for heparin. BUN relates to kidney function. Platelets may be affected, but are not the primary focus. 3. A client on furosemide is at risk for which imbalance? A. Hyperkalemia. B. Hyponatremia. C. Hypokalemia. D. Hypernatremia. Answer. C. Hypokalemia. Rationale. Furosemide is a loop diuretic that promotes potassium loss, risking hypokalemia. 4. Which symptom is most concerning for a patient taking clozapine? A. Drowsiness. B. Dry mouth. C. Sore throat with fever. D. Weight gain. Answer. C. Sore throat with fever. Rationale. Clozapine can cause agranulocytosis, a serious drop in white cells. A sore throat with fever may indicate infection. 5. Which medication requires avoiding grapefruit juice? A. Lisinopril. B. Metoprolol. C. Atorvastatin. D. Furosemide. Answer. C. Atorvastatin. Rationale. Grapefruit inhibits CYP3A4 enzymes, increasing statin levels and risk for toxicity. 6. A nurse administers morphine. What is the priority assessment? A. Pain score. B. Respiratory rate. C. Bowel sounds. D. Pupil size. Answer. B. Respiratory rate. Rationale. Opioids can suppress respiratory function. Monitor for respiratory depression. 7. What instruction is most important for a client starting metformin? A. Take with food. B. Avoid caffeine. C. Monitor potassium. D. Expect weight gain. Answer. A. Take with food. Rationale. Metformin can cause GI upset. Taking it with food reduces symptoms. 8. What should be monitored in a patient taking lithium? A. Sodium levels. B. Hemoglobin. C. INR. D. Calcium. Answer. A. Sodium levels. Rationale. Lithium levels are influenced by sodium. Low sodium increases lithium toxicity risk. 9. A nurse is preparing to administer heparin subcutaneously. What is the proper site? A. Deltoid. B. Gluteus. C. Abdomen. D. Thigh. Answer. C. Abdomen. Rationale. The preferred site for subcutaneous heparin is the abdomen, at least 2 inches from the umbilicus. 10. Which medication is contraindicated in pregnancy? A. Acetaminophen. B. Warfarin. C. Labetalol. D. Folic acid. Answer. B. Warfarin. Rationale. Warfarin crosses the placenta and can cause fetal defects. 11. What adverse effect is associated with ACE inhibitors? A. Diarrhea. B. Cough. C. Insomnia. D. Weight loss. Answer. B. Cough. Rationale. A dry, persistent cough is a common side effect of ACE inhibitors like lisinopril. 12. What is the antidote for heparin overdose? A. Vitamin K. B. Protamine sulfate. C. Naloxone. D. Flumazenol. Answer. B. Protamine sulfate. Rationale. Protamine sulfate reverses the effects of heparin. Vitamin K is for warfarin. 13. Which action is appropriate before administering vancomycin? A. Check blood sugar. B. Monitor potassium. C. Assess creatinine. D. Administer a bronchodilator. Answer. C. Assess creatinine. Rationale. Vancomycin is nephrotoxic. Renal function should be monitored. 14. A client on gentamicin is at risk for which side effect? A. Constipation. B. ototoxicity, C. Hypotension, D. bradycardia. Answer: B. Ototoxicity. Rationale: aminoglycosides can damage the 8th cranial nerve, leading to hearing loss. 15. What should be avoided when taking MAOIs? A. Dairy, B. Grapefruit, C. Aged cheese, D. Chocolate. Answer: C. Aged cheese. Rationale: aged cheese contains tyramine, which can cause hypertensive crisis with MAOIs. 16. What is a common side effect of prednisone? A. Hypoglycemia, B. Hyperkalemia, C. Hyperglycemia, D. Constipation. Answer: C. Hyperglycemia. Rationale: corticosteroids increase blood glucose levels. 17. A client reports yellow vision while taking digoxin. What should the nurse do? A. Document and monitor, B. Hold the drug and notify the provider, C. Administer potassium, D. Encourage fluid intake. Answer: B. Hold the drug and notify the provider. Rationale: yellow vision is a sign of digoxin toxicity and must be reported. 18. When giving nitroglycerin sublingually, what should the nurse instruct? A. Swallow the tablet, B. Chew the tablet, C. Place under tongue until dissolved, D. Take with food. Answer: C. Place under tongue until dissolved. Rationale: sublingual nitroglycerin should dissolve under the tongue for rapid absorption. 19. Which insulin has the fastest onset? A. NPH, B. Regular, C. Lispro, D. Glargine. Answer: C. Lispro. Rationale: Lispro is a rapid-acting insulin with an onset of 15 minutes. 20. Which lab value should be monitored for a client on enoxaparin? A. INR, B. APTT, C. Platelet count, D. Hemoglobin A1C. Answer: C. Platelet count. Rationale: enoxaparin can cause heparin-induced thrombocytopenia. Monitor platelets. 21. A client is taking albuterol. What side effect is most common? A. Bradycardia, B. Diarrhea, C. Tachycardia, D. Rash. Answer: C. Tachycardia. Rationale: albuterol, a beta-2 agonist, can stimulate the heart, causing rapid heartbeat. 22. What should the nurse assess before administering atenolol? A. Bowel sounds, B. Respiratory rate, C. Heart rate and blood pressure, D. Visual acuity. Answer: C. Heart rate and blood pressure. Rationale: atenolol is a beta blocker that lowers BP and HR. Monitor both before giving. 23. The nurse knows that naloxone is used to reverse which drug's effects? A. Diazepam, B. Morphine, C. Heparin, D. Aspirin. Answer: B. Morphine. Rationale: naloxone is an opioid antagonist used to reverse opioid toxicity like morphine. 24. Which is a serious adverse effect of phenytoin? A. Blurred vision, B. Gingival hyperplasia, C. Constipation, D. Hypertension. Answer: B. Gingival hyperplasia. Rationale: phenytoin commonly causes overgrowth of gum tissue. 25. What instruction is important for a client on tetracycline? A. Take with dairy, B. Avoid sunlight, C. Take at bedtime, D. Limit fluids. Answer: B. Avoid sunlight. Rationale: tetracyclines cause photosensitivity. Clients should avoid sun exposure. 26. What is the most important instruction for a patient prescribed levothyroxine? A. Take at bedtime with food, B. Take in the morning on an empty stomach, C. Take with calcium supplements, D. Skip doses on weekends. Answer: B. Take in the morning on an empty stomach. Rationale: levothyroxine absorption is best on an empty stomach 30 to 60 minutes before breakfast. Calcium reduces its effectiveness. 27. A nurse is administering naloxone. What is the priority action after giving the dose? A. Check pupil reaction, B. Assess respiratory status, C. Monitor bowel sounds, D. Encourage fluids. Answer: B. Assess respiratory status. Rationale: naloxone reverses opioid-induced respiratory depression, so respiratory rate and effort must be monitored closely. 28. Which finding is most concerning in a patient receiving epoetin alpha? A. Increased energy. B. Elevated hemoglobin to 13.5 g/dl. C. Chest pain and hypertension. D. Improved appetite. Answer: C. Chest pain and hypertension. Rationale: epoetin can increase the risk of thromboembolic events. Chest pain and high BP may indicate complications. 29. Which of the following is a priority instruction for a patient taking alendronate? A. Lie down immediately after taking. B. Take with orange juice. C. Remain upright for at least 30 minutes. D. Take before bedtime. Answer: C. Remain upright for at least 30 minutes. Rationale: alendronate can cause esophageal irritation. Patients must sit or stand upright to prevent reflux and injury. 30. What lab value must be checked before administering the next dose of vancomycin? A. Hematocrit. B. BUN. C. Trough level. D. White blood cell count. Answer: C. Trough level. Rationale: trough levels guide dosing and help prevent toxicity. High trough levels increase nephrotoxicity risk. 31. A client receiving isoniazid INH should be monitored for which complication? A. Hepatotoxicity. B. Cardiotoxicity. C. Renal failure. D. Seizures. Answer: A. Hepatotoxicity. Rationale: INH can cause liver damage. Monitor for jaundice, fatigue, and elevated liver enzymes. 32. A client with a penicillin allergy may also react to which drug? A. Erythromycin. B. Tetracycline. C. Cephalexin. D. Ciprofloxacin. Answer: C. Cephalexin. Rationale: cephalosporins like cephalexin have a cross-sensitivity with penicillins. Use caution or avoid if allergic. 33. Which teaching point is essential for a client prescribed nitroglycerin patches? A. Keep patch on during sleep. B. Apply to hairy areas for absorption. C. Rotate application sites daily. D. Use patch only during chest pain. Answer: C. Rotate application sites daily. Rationale: rotating sites prevents skin irritation. A nitrate-free period at night helps prevent tolerance. 34. What adverse effect should the nurse monitor for in a client on spironolactone? A. Hypokalemia. B. Hyperkalemia. C. Hyponatremia. D. Hypernatremia. Answer: B. Hyperkalemia. Rationale: spironolactone is a potassium-sparing diuretic. Monitor for signs of potassium overload. 35. Which action is essential before starting a patient on an aminoglycoside antibiotic? A. Assess for vision loss. B. Measure blood pressure. C. Check creatinine and BUN. D. Monitor blood glucose. Answer: C. Check creatinine and BUN. Rationale: aminoglycosides are nephrotoxic. Baseline renal function must be assessed. 36. What is a serious adverse effect of amiodarone? A. Photosensitivity. B. Bradycardia. C. Pulmonary toxicity. D. Hypotension. Answer: C. Pulmonary toxicity. Rationale: amiodarone can cause fatal pulmonary fibrosis. Monitor for cough, dyspnea, or abnormal lung sounds. 37. Which statement indicates understanding of insulin glargine administration? A. I will mix it with regular insulin in one syringe. B. I will take it with meals. C. I will take it once daily at the same time. D. I can stop it if my blood sugar is normal. Answer: C. I will take it once daily at the same time. Rationale: insulin glargine is long-acting and not mixed with other insulins. It maintains basal insulin levels. 38. Which finding indicates a possible allergic reaction to 4-ceftriaxone? A. Diarrhea. B. Itching and swelling of lips. C. Fatigue. D. Nausea. Answer: B. Itching and swelling of lips. Rationale: swelling and itching may indicate anaphylaxis, which is life-threatening and requires immediate action. 39. What adverse effect is associated with long-term use of proton pump inhibitors, PPIs? A. Hypokalemia. B. Hypercalcemia. C. Vitamin B12 deficiency. D. tachycardia. Answer: C. Vitamin B12 deficiency. Rationale: long-term PPI use decreases stomach acid, reducing absorption of B12 and calcium. 40. What is the therapeutic range for phenytoin? A. 2 to 5 mcg/ml. B. 10 to 20 mcg/ml. C. 0.5 to 2 mcg/ml. D. 50 to 100 mcg/ml. Answer: B. 10 to 20 mcg/ml. Rationale: the therapeutic range of phenytoin is 10 to 20 mcg/ml. Levels above this increase toxicity risk.